day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College, Section 11A, Group 44. Today I will be presenting my written demonstration in administering parenteral medication to the patients. One advantage of this is their ability to improve medication adherence because some patients struggle with taking oral drugs as directed. Of course, the materials that we are using for this assessment is of course, we need to have the hypodermic tray. And of course, we will be having the medication ticket. I have the orange one here. And of course, let's have our solution prescribed. So, it will be like the paracetamol vial and of course, the sodium chloride ampule. So, next is that for the intradermal, of course, we will be needing a 1 ml syringe and a needle gauge of 25 to 26. And of course, we will be having like another 1 ml syringe with a needle gauge of 25 to 30 for subcutaneous injection. And lastly, we will be having 5 ml syringe for intramuscular, and of course its needle gauge is from 20 to 22. And of course, do not forget to have the sterile aspirating needle for withdrawing the medication. And of course, the cotton ball soaked in 70% alcohol. And of course, the case pad here and here. So after that, we should have a waste receptacle. I have one improvised here for the syringes and needles. And of course, do not forget to have the gloves. So after that one, let's start with intradermal injection. This will be the introduction of a solution by means of a syringe and the needle into the superficial layer of the skin. Of course, first we will be checking the doctor's order on the patient's chart because the chart of the patient is more reliable than the medication tickets. So I have the medication tickets here, and as I can see here, the doctor's order on the yellow sheet aforementioned that the patient has a moderate fever and his temperature that was taken 3 minutes ago by another nurse is having 37.9 degrees Celsius. So we will be having first or giving intradermal injection for our patients today. So next, prior to performing the procedure, we need to introduce ourselves and verify the client's identity using the agency protocol for us to verify that we are administering the right medication to the right client. Good day, sir. My name is Kenneth D. Velasquez, resident nurse for today from Davao Doctors College. So before we start, sir, may I see your wristband, please? So can you please tell me your full name, sir? How about your birth date, sir? So that is the 2 identifiers. So thank you for that, sir. What will you like me to call you, sir? So how's your day going so far, sir Miles? That will be nice to hear, sir. And after that, also explain the procedure to the clients and how he can participate during the procedure, because this will be help to reduce anxiety and it will enhance cooperation. So, Sir Miles, today, in accordance with your doctor's order, I will be administering intradermal injection to you, sir. So I will be using a syringe to inject the medication to you. So do you have any other questions? Okay. So next, we will be needing to perform hand hygiene and observe appropriate infection procedures for us to deter the spread of microorganisms. Okay, so after that, we will be arranging the medication card on the hypodermic tray with the corresponding drug, because organization and planning results in economy of time and efforts, and it will minimize confusion. So first, of course, we will be basing we will be basing it in this improvised electronic medication administration record. So it shows here that the right patient is Miles Ceballos. And of course, before entering the room, you must check for the room number, which is 210. And of course, the right medication for the intradermal injection, we will be having a paracetamol vial. Let's check my ID first for login. And then the paracetamol vial for verification. So the right dosage is 0.75 ml. The right route is intradermal. And of course, it will be every 6 hours. So the time here is 10 a.m., which is exact. And we'll be going back at 4 p.m. to be exact. So that is the first safety check. So of course, we will be using a 1 ml syringe. Let's use that one. And this will be the aspirating needle. Of course, draw up some air. It will be 0.75 ml and gets your, this one here, gets your paracetamol vial, this one here, and then push the air, and then that's the time that we will be withdrawing the medication. So it will be 0.75 at a eye level, so that you will be having the right measurements. So after that, for us to check, click it here, and then if there will be like bubbles here, you just need to like push it in the like that. So next is that change the aspirating needle to the needle gauge for the intradermal injection. And then bring this one with the medication ticket so that you will not be confused, just like this. So let's arrange this one. So it will be here. So this, before entering the room, of course, we will be checking the second safety check. Again, the right medication is paracetamol vial, 0.75 ml, as I can see here. And then the right route is intradermal, and the time is 10 a.m. So we can proceed. So now, choose an injection site free from lesion and discoloration. So the site for intradermal is the forearm, because the forearm is convenient and easy location for introducing an intradermal intradermally. So in general, the site is 3 to 4 widths below the antecubital space. The antecubital space is here, then 3 to 4 fingers. And so next is 1 whole finger or 1 hand above the wrist, and this will be the sites. So of course, next we need to position the patient's arm so that his elbow and forearm will be supported in a flat surface. Okay, Sir Miles, can you please adjust, please? Okay, and then just bring your hand here, sir. Okay, so after that one, of course, we must also apply clean gloves. And of course, after applying these clean gloves, the next procedure is that we will be cleaning the area or disinfecting the area with a cotton ball soaked in 70% alcohol. Or of course, use an antiseptic swab to clean the sites. Of course, beginning at the center in a circular motion outward about 2 inches or 5 to 5 centimeters. Okay, sir. Thank you. So, in this, of course, we will be removing the cup and hold the syringe between the thumb and the forefinger of your dominant hand with the level of the needle pointing up. So since my dominant hand is the left, so we will be using this one. So remove the needle just like this, place it in the waist receptacle. So of course we need to stretch the skin tons at the injection sites by pulling gently, of course, with the thumb and the forefinger at your non-dominant hand, because taut skin provides an easy entrance into intradermal tissues. So pull the needle very close to the patient's skin and insert it slowly 5 to 15-degree angle until you feel the resistance, because intradermal tissue will be entered when the needle is held as near as possible. So of course we will be demonstrating this one with an eggplant. So of course, sir, can you please hold this one? Are you comfortable? So it will be like this, the position. So of course we need to slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite that will appear on the patient's skin. I will be injecting now, sir, okay? Of course, do not forget this one. So if a small wheal appears, all solutions are in intradermal tissue. Of course, after that, so withdraw the needle and the same angle that it was inserted, and this will be minimizing the tissue damage and discomfort for the patient. Of course, pat using dry cotton ball and do not massage the area. And of course, after that, encircle the wheel with blue or black pen and instruct the patients not to rub the wheel or erase that mark. Of course, do not forget to make your area clean always. And of course, we need to mark this one. Sir, I would like to advise that do not to touch this one or remove, okay? So also do not use any red pen because it may influence the reading, and having the patient rubbing the area may interfere the test results by spreading the meds to the subcutaneous tissue. Of course, next, we need to assist the patient to a comfortable position and indicate at the back of the medicine card the sites and due time for reading, and this will serve as a reminder for us on the procedure. Okay, sir, can you please go back in your position a while ago? Thank you for your cooperation, Sir Miles. Let me just document this one. 10 a.m. Okay, so take note to avoid recupping the used needle and discard it with the syringe to appropriate receptacle for us to prevent any needle prick injury. So as you can see a while ago, this is my waist receptacle. As I withdraw the needle, I immediately waste it in the receptacle. So that is the right procedure to do. So lastly, we need to wash our hands to deter the spread of microorganisms, of course, before documenting the procedure, and interpret the results after 30 minutes. Have your signature here. And thank the client for his cooperation. So thank you, Sir Miles. This will be the end of my assessment. So I will be going back at 4 p.m., okay? Goodbye. Thank you. So next is the subcutaneous injection. So a quick recap. This is the introduction of a small amount of solution by means of a syringe and needle into the adipose tissue beneath the skin. Of course, first, again, we will be checking the doctor's order and the patient's chart, because the chart of the patient is more reliable than the medication tickets. Again, this is my medication ticket, and this is the doctor's order or the yellow sheets. And of course, the second one is that The patient has moderate fever and his temperature was taken 3 minutes ago, having 38 degrees Celsius. So for the remedy, we'll be giving subcutaneous injection for a patient today. So next, prior to performing the procedure, of course, we need to introduce ourselves and verify the client's identity using the agency protocol for us to verify that we are administering the right medication to the correct clients. Good day, sir. My name is Kenneth D. Velasquez, your student nurse from Davao Doctors College. So before we start, may I see your wristband, please? Can you please tell me your full name, sir? How about your birth dates? Thank you for that. So how would you like me to call you? So Sir Miles, how's your day going so far? That will be nice to hear, sir. And after that, also explain the procedure to the clients and how he can participate during the assessments, because this will help to reduce anxiety and enhance cooperation. So Sir Miles, again, I will be administering your paracetamol vial through a subcutaneous injection. So we will be using a syringe to withdraw or to administer the medication. Do you have any other questions, sir? Okay. So next, of course, we need to perform hand hygiene and observe appropriate infection prevention procedures for us, of course, to deter the spread of microorganisms. Of course, we need to arrange the medication card on the hypodermic tray with the corresponding drug, because organization and planning results in economy of time and effort and minimize confusion. Of course, before we do that, so we must check the medication administration record. So I have one here, an electronic one, improvised. So as I can see here, the patient is Miles Ceballos. Of course, we must log in first. And then the right medication is the paracetamol vial. This is the dosage is 0.75 ml, and the route is subcutaneous, of course. And the right time is 10 a.m., which is 10 a.m. And now we can prepare the medication using, of course, a 1 ml syringe. So I have here my aspirating needle, and of course, remove the cap, the waste receptacle, and it's 0.75. And then you will be releasing the air into the paracetamol vial, and you can now withdraw the medication. Okay, so after that, so for us to check, we must click it to get away with the bubbles, and for us to sure, dispose it in the sink, and that would be it. And of course, change the aspirating needle with a needle gauge. Of course, after that, prepare the medication tickets besides the injection or the syringe, and then we can now have our second safety check. This is paracetamol vial, of course, and then the right dosage is 0.75 ml, as we have done a while ago, and then the right route is subcutaneous, and it's 10 m. So now, of course, we will be discussing the purpose of each medication to our patients, allowing the patients to ask questions and find out where the last injection was given, because this information can facilitate acceptance and compliance with the therapy. Okay, Sir Miles, before we proceed with the assessments, do you have your injections? Okay. So, of course, sir, in subcutaneous injection, I will be administering paracetamol vial. This is for your moderate fever, sir. But for the side effects, it may cause you rash and swelling. So for that concern, sir, do you have any other questions? So we can proceed. Okay, thank you. So next is we need to determine which sites you'll use. So the sites where a skin appears to be healthy and free from irritation and inflammation reduces the discomfort of injection. So the sites is of course the abdomen of the patient. Of course, after that, shift the patient's bed, then expose only the potential injection sites and inspect the area for bruising, inflammation, and edema. Okay, sir, can you please adjust? Okay, sir, I'm exposing your abdomen, sir, okay? So, is your temperature okay? Now exposing your abdomen. And follow the rules in the assessing the abdomen here. Are you comfortable? And you are supposed to bring a pillow here, and then you can proceed. Of course, there are no any masses or any bruises, so we can proceed in the procedure. Of course, next, palpate the sites and avoid any area that is tender. Start with the right lower quadrant, of course. So can you please tell me, sir, if you feel any pain, okay? The right upper quadrant, the right, the left upper quadrant, and the left lower quadrant. Okay, so for us to make sure that you have the right size needle, of course, we need to use your thumb and forefinger to grasp a skin fold of a tissue at the injection site and measure the fold from top to bottom and check to ensure that the needle is about half as long, because of course cushioning and subcutaneous tissue helps to ensure having the needle enter into the areal connected tissue. So as you do this, of course, look at the patient's facial expression for you can identify if the patient has any tenderness or any masses there or any pain. So we will be using 1 ml syringe here, okay? So after that, so we need to place the patient in a comfortable position and ask the patient to relax the area you are about to inject. Okay, sir, so I'm going to adjust it here. So I will be assessing or administering the injection here, sir, in the left lower quadrant, okay? So just relax. So when did you eat your breakfast, sir? Okay. So of course, we need to apply clean gloves and just wait for a minute here. And of course, after applying this clean gloves, the next procedure is that we will be cleaning the area or disinfecting the area with a cotton. So of course, we need to clean the sites with an antiseptic swab in a circular motion, starting from the center outward. We must use the cotton ball because friction aids in cleaning the skin, and a clean area is contaminated when salt object is rubbed over its surface. So let's start here. Throw this one, and then next we will be needing this one. So of course, remove the needle cup by pulling it straight off and hold the syringe between the thumb and the forefinger of your dominant hand. It's like you are holding a dart. So first we must remove this one, then holding a dart. And of course, we need to insert the needle quickly and firmly at a 45 or 90-degree angle, and pain is minimized by inserting the needle without hesitation. So, of course, we will be using the eggplants here. Okay, sir, so can you please I'm inserting this one, sir, okay? So, of course, after inserting, release the pinch of the skin and rest your non-dominant hand on the patient. So after that, we need to move our dominant hand at the end of the plunger and slowly inject the medication over several seconds and retain your grasp on the syringe and keep it still. Okay. So after that, quickly withdraw the needle because depressing the skin places counteraction and it also minimizes this patient's discomfort when the needle is withdrawn. So of course, after that, we will be placing a swab or a gaze pad on the sides and apply gentle pressure, but of course, do not massage the area. Okay, move this one. So, of course, after that, place the patient in a comfortable position and document the procedure after that one. Okay, sir, can you please? Do you want to drink water, sir? Are you comfortable? Do you have any other questions? Okay, so lastly, document this one in the medication ticket, and then it's the abdomen, left lower quadrant, and the time is 10 p.m. And of course, lastly, we need to record the time and amounts of the drugs on the medication sheets because this prevents the medication errors, as I have done a while ago. Sir, I'm documenting this one, and of course, do not forget to sign. Sir Miles, I'm done with the assessment. Thank you very much for your cooperation. Do you have any other queries? Okay, thank you, Sir Miles. I will be right back at 4 p.m. to administer subcutaneous injection, okay? Goodbye. Lastly, we'll be performing the intramuscular injection. So a quick recap, this is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. So first, again, we'll be checking the doctor's order and the patient's charts because the chart of the patient is more reliable than the medication tickets. So I have here the medication tickets, and the doctor's order here says that the patient is experiencing dehydration, so we will be giving intramuscular injection for our patient today. So, of course, prior to performing the procedure, of course, we need to introduce ourselves and verify the client's identity using the agency protocol for us to verify that we are administering the correct medication to the right client. Good day, sir. My name is Kenneth D. Velasquez, your student nurse from Davao Doctors College. So, before we start, sir, may I see your wristband, please? So, can you please tell me your full name, sir? How about your birth date, sir? Again, that is the two identifiers. So, what would you like me to call you, sir? So, Sir Miles, how's your day going so far? That will be nice to hear, sir, and I really hope that our day will end up a good one. And of course, after that, also explain the procedure to the clients and how he can participate during the assessment or the procedure, because this will help to reduce anxiety and enhance his cooperation. So, Sir Miles, today, of course, I will be giving you a sodium chloride and I will be injecting it intramuscularly. And of course, for you to be informed, sir, this sodium chloride will treat sodium loss because of your dehydration, also basing with the doctor's order. And of course, sir, the side effects of this, it may cause you swelling. So, I will be just injecting this one here in this area. Do you have any other questions? Do you have any other requests? Okay. So, next, we need to perform hand hygiene and observe appropriate prevention procedures for us to deter the spread of microorganisms. So, after, we need to arrange the medication card on the hypodermic tray with the corresponding drug because, of course, organization and planning results in economy of time and efforts and minimize confusion. So, right now, of course, lastly, we will be checking the medication in the electronic medication administration record here. And it says here that my patient's is mild Sibelius that I have checked a while ago. The right medication is sodium chloride in ampule. So the right dosage, we will be administering 3 ml for the patient. And let me just verify this one here first. The right route is intramuscular, and the right side is every 6 hours, 10 a.m., which is 10 a.m. So of course, we need to withdraw the medication. So this is the 5 ml syringe for intramuscular. We will be withdrawing the medication from the ampule. So this is a sample of a sodium chloride ampule. So let us start. So of course, the thing that I have done a while ago is the first safety check. So now we will be doing this ampule. So first, click this one until the liquid from the top will be transferred below. So as you can see, the liquid is gone, and you will be noticing a dot here. This is the indication where you will break the glass. Of course, you need to break this one away from you so that you will not be hurt, or so that there are no any glass that will left in the medication. So let us start. Just twist, and then like that, and then bring this one in the waste receptacle. So of course, withdraw the medication with your syringe. So this is the aspirating needle first, and then we will be withdrawing 3 ml. So just like this, withdraw the medication, 3 ml. Okay. So of course, do not forget to throw this in the waste receptacle. So of course, click this one and then avoid the excess. Okay. So after that, transfer the aspirating needle to the needle gauge. So this is the needle gauge. And then, of course, bring this one with the medication ticket. So let us have our second safety check. The right medication is sodium chloride in ampule. The right dosage is 3 ml. And then the right route is intramuscular, and every 6 hours, 10 a.m. So as you can see, the room is 210, as I have checked earlier. So now we will be selecting an appropriate site for the injection. And of course, the vastus internalis and the deltoid muscle is the possible sites for the intramuscular injection. So of course, next we will be examining the integrity and amount of the patient's muscle mass by palpating the muscle area, and if there are tenderness, these are not suitable for the injection sites. Okay, Sir Miles, can you please turn your body facing from me, sir? I'm exposing this one here, sir, okay? And this one here. Can you please move your head there, sir? Then move your legs here, sir, so that I can execute properly. Here, sir, go. Okay. Are you comfortable? Can you please tell me, sir, if you feel any pain? So let us do a deep palpation rather. Do you feel any pain? So this is the indication that we can now proceed to the next step. Of course, we will also be inspecting the area for any bruising, inflammation, and edema. And if the skin shows bruises or inflammation, use the other sides. So as I can see here, as I inspect, there are no any redness, any bruising, or any edema for the patient, so we can proceed. Next is to help the patient find the comfortable position that will accommodate the injection sites you have chosen and only expose the sites. Okay, sir. So as I have done earlier, I'm going to ask again, is this the most comfortable position, sir, for you? Okay. So next is that we will be applying clean gloves again and use anatomical landmarks to find the sites again. So this is the clean gloves again. Just wait for a minute. Okay, so when we say anatomical landmarks, this is the ventrigluteal area here, and this is the deltoid muscle here. So I'm going to ask, sir, have you undergone any injection? Okay, so we can use the ventrigluteal area. And so of course, so there is a, we need to follow the procedure when we are injecting in the ventrigluteal area. Of course, since this is for the ventrigluteal injection, which is preferred for adults and children more than 7 months old, we need to place the heel of your hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur. So, as you can see here, this is my thumb pointing here. And of course, we need to point the thumb towards the patient's groin, as you can see. And then point the index finger to the anterior superior iliac spine. So if you can see here, my index finger is located in the anterior superior iliac spine of the patient. And of course, we need, of course, extend the middle finger back along the iliac crest toward the buttocks. So as you can see here, I have formed a V line or V shape. So the index finger, the middle finger, and the iliac crest form a V-shaped triangle, and the injection site is the center of the triangle. So for you to not be confused, of course, we will be adding like a clue by adding this gaze pad here. This will be our clue. So after that, we need to disinfect the injection site in a circular pattern from inner to outer for about 2 inches for us to prevent any entry of microorganism. Of course, next, we need to hold the gaze pad between the 3rd and 4th fingers of your non-dominant hand. This will be the gaze pad. Just like this. We need to hold this like this. Of course, we need to, after that, we will be removing the needle cap by pulling it straight up and hold the syringe with the thumb and forefinger of your dominant hand, so like you are holding a dart. So after that, place your ulnar side of your non-dominant hands just below the injection sites and pull the patient's skin laterally about 1 to 1.5 inches. So just like this, and then just like that. So of course, hold this position until you inserted the needle. So since my patient has a little mass, we need to grasp the body of the muscle between, of course, your the thumb and the forefinger. Grasp this one because our patient is has a mass here. And so of course, just like this, as you can see, if you will be having a mass, you were like this. So again, put this one here, and then we will be examining this one with an eggplant, of course. Can you hold that for me, sir? Just like this. Okay, sir. So of course, with your dominant hand, we will be quickly pursing the muscle at a 90-degree angle to the skin, continuing to pull the skin taut with your non-dominant hands. Of course. Of course, after that, we will be aspirating. We need to aspirate the syringe by, of course, pulling back the plunger with your dominant hand. As you can see, there is no blood appears. But if a blood appears, you are not in the muscle and you need to remove and discard the needle syringe and start over. And again, since no blood appears, we can proceed to the next procedure. Of course, we need to inject the medication slowly at the rates of 1 ml in 10 seconds and wait 10 seconds and smoothly withdraw the needle. And then, on the side, but take note to apply gentle pressure here and do not massage the area. Okay, thank you, sir. Of course, lastly, we need to place the patient in a comfortable position and document the procedure. In the medication ticket, of course, in your documentation, you need to again place your signature. Okay, sir. The assessment is done. Thank you very much. You can now place here. Do you want to drink water, sir? Okay, sir. You can just sit down. Oh, later. Okay. Okay, sir. So that will be the end of my assessments for today. Thank you very much for your cooperation, sir. And again, I will be right back at 4 p.m., sir. Okay? So thank you very much, sir. Have a nice day.